Hi, my name is Dr Craig Mallorie. I'm here today to talk to you about what to do after you've had a dental extraction. So you're probably feeling very numb, so you need to initially be careful with hot food and drinks because you do not want to add to your misery by burning your lip or chin. So be careful with what you're eating. Also be careful of biting your tongue if your tongue is numb because again this will add to your discomfort. So in the initial period whilst you're numb, I advise my patients to take an anti-inflammatory medication such as ibuprofen, as long as you don't have any medical issues that prohibit taking ibuprofen. So if you take the initial dose of ibuprofen whilst you're numb, it allows time for it to get into the bloodstream to then be acting for when the numbness starts to wear off. I also advise my patients to take a paracetamol-based painkiller, such as plain paracetamol, or paracetamol with some codeine, such as cocodamol, 2 hours after taking the ibuprofen. Then you begin this regime of ibuprofen, and then 2 hours later cocodamol or paracetamol, and then 2 hours later ibuprofen. And alternating between those two medications during the first 2 to 3 days will really help keep things very comfortable for you. It's important not to exceed the maximum doses of those painkillers, which is usually 4 doses of ibuprofen or 4 doses of the cocodamol or paracetamol in a 24-hour period. So over the first 3 days after surgery, your body will naturally want to swell in the area. The swelling varies depending on the trauma during the surgical procedure, but usually most swelling is greatest at day 3. So for those first 3 days, particularly if you can take the ibuprofen regularly, that will really help keep the swelling to a minimum. Try and ice the area for the first 24 hours, 10 minutes on, 10 minutes off, keep the area nice and chilled, and that will help with reducing the swelling. Also try and limit physical activity during that first 24-48 hours, because when we start doing some physical activity, it raises your blood pressure, raises your heart rate, it's going to increase the blood flow to the area, which will increase the swelling. It may start to bleed a little bit, and it could start to hurt a little bit more if you're doing that. So try and relax for the next few days. With regards to bleeding after the surgery, usually I would never let a patient leave my surgery whilst it's still bleeding or whilst we're still trying to control bleeding. But if you accidentally traumatize the area, then we give you packs of sterile gauze which you can roll up into a little ball and place over